So if you had a stroke or a TIA, there are several risk factors. Some of the risk factors you can control, there are other risk factors you cannot control. So if I talk about the risk factors that you can control, the obvious ones like smoking. Smoking reduces your blood flow to the brain and you increase your risk of blood clots because not the if your blood flow is sluggish, nutrients are sluggish, you're actually starving the brain of oxygen. Smoking also increases the deposition of the cholesterol, like what they call plaques, which hardens in the arteries, which again disrupt the blood flow to the brain. And then you've got alcohol intake. Again, alcohol is a risk factor for strokes. You've got people who do not exercise. It's quite important to exercise to reduce your risk of stroke. Funny enough, this is one cause that a lot of people do not mention, which is dehydration. If you're dehydrated, you're actually increasing your risk of having a stroke. So it is advised that stay hydrated, drink at least five glasses of water a day to keep yourself hydrated to prevent your chances of having a stroke. Again, lack of exercise is something that can lead to weight gain or obesity, which is not as it's argued that obesity on its own is not a risk factor for a stroke, but if combined with other risk factors, that increases your risk of having a stroke. Obviously, if you've had a stroke before, you're at higher risk of having another stroke. If you've got high blood pressure, pardon me, that is something again you can control by reducing your high blood pressure through lifestyle measures or medication, depending on where you are with your blood pressure. Cholesterol, again, through lifestyle factors and medication. If your cholesterol is too high, increases your risk factors of having a stroke. Then factors you cannot control would be, for example, your age. As you get older, you increase your risk of having a stroke, though as we know, there are people in their 20s, 30s and 40s that have had a stroke, which is higher if you have a family history of strokes, which is again something you cannot control. Then more investigation needs to be done as whether you've got some clotting factor that runs in the family that predisposes you, to having strokes. Then we talk about gender. Men are higher risk of stroke than women. Women have, until they reach the age of menopause, they have estrogen, which is thought to be a protective factor, against having strokes. There are other causes. Trauma as well. If you've had a trauma, that increases your risk of stroke. If you're someone that's having epileptic seizures, again, damage to the brain can increase your risk of stroke. If you have a tumor in the brain, that again can increase your risk of a stroke. So, there are several factors. Again, another factor is recreational drugs. Taking stuff like cocaine, crack, these are all risk factors for strokes, and it's controlling and managing these risk factors that reduces your chances of having a stroke.